Dr. K here, ICU doc. Listen, I recently gave a talk to some of our future leaders in this country in terms of principles when it comes to leadership. How do you become an effective leader? And I actually got quite emotional during that talk because it was clear to me right now in our country, we need strong leadership. People want that permission to make bold moves. And I guess why I wanted to jump on right now is to encourage folks, this is the time for boldness. The country needs you now. I'm going to focus on healthcare because to me, this is one of the most pivotal times that we are looking at in our healthcare system now. And what we need is that bold and strong leadership, straight up. So when I often give these talks, it's based on the principles of unapologetic leadership. So talking about values over fear, favoring action, having an environment where people can think outside the box and have those creative solutions, having that creative courage. And I can't tell you how important that is now. Like when we think about making decisions from our values, not fear. I look at our healthcare system. People are struggling. People are without family docs. People are waiting for a long time for their surgeries. The time is for bold action. When we look to our values, is reaching out, being there for our fellow man and person and woman, being there for our fellow Canadians, making sure that the basic needs are being met in terms of healthcare, not having to be dysfunctional for a prolonged period of time. You know, when it came to values over fear, this is what we saw during the pandemic. This is what was going on in our household when we thought, hey, are we going to speak up to some of the concerns that we have about some of our policies, our schools being closed, our kids and their mental health being compromised? Are we going to speak up about some of the racialized communities that are getting hit the hardest and we're not coming up with creative solutions to be able to address their needs? We're going to talk about how our nursing homes are getting lit up. So why not build some resources for them so that they can be protected? And as many of you know, and you're still to this day, it feels like there's still a threat when it comes to talking about these things. That cancel culture was huge. But in our house, we said, it's our values. That's what we're going to lean on. We stick up for those that can't stick up for themselves. We are an example for our kids. This is what the power of focusing on your values. And this is what we need in this country right now. The second major principle we talk about is leaning on action, not waiting for permission. Moving, hustling, making a call, knowing that it's coming from a good place, from your values. We did this a few times in the pandemic. We created a metabolic health clinic for our racialized communities. We did fundraisers to feed the frontline staff that were developed within a week. We moved. We created Solving Wellness. We wanted to be able to not wait for permission, not wait for perfection, lean on action. And this is what we need right now. Like, how long we talk about this in this country, this lack of primary care? And like, let me give you an example of something that's really irking me. If I want to help out in Manitoba right now, say they're short staffed, or say you're a nurse and you want to help out in Manitoba right now, it would be like, I'm going to say 4 to 8 weeks of paperwork to be able to step up. I don't have permission to be able to practice in another province. I have to apply. You tell me my skills, I can't represent in Manitoba or any other province? This should be national licensure. Take away barriers. Yesterday, if I'm a nurse that wants to help out in Nova Scotia, it's the same issue. You still got those barriers. Like, when are we going to actually do something about this stuff? We've been talking about it for ages. Action, folks. Swing them back. This is the time. Once again, I'm focused on healthcare, but this is pertinent to so many other sectors within our system and within our country right now. Swing the bat. The last thing I want to say is encourage an environment where outside the box thinking can thrive. Have that creative courage. One of the clinical examples I often give in my talk is I was with a patient that who unfortunately we lost her airway. She self-extubated. And one of the most timid respiratory therapists, they were young, said, why don't we try this Hooper maneuver, which you won't be able to even Google this thing. It was a way of oxygenating somebody through the nose that one of our docs kind of MacGyvered one day, and it literally saved this patient's life. And they felt enough courage and boldness to speak up in a room that was totally chaotic. And I remember when she said that, I was like, yes. I'm like, we're doing this now. And literally was a measure that saved that patient's life. And so what are we doing as a society? What are we doing as an organization for people to be able to speak up, to have those creative solutions and get rid of that either or thinking? Think about multiple solutions. Think about integrative thinking. So the example I like to give is with Roger Martin. He's one of my favorite episodes we did on our show, where if you're doing a film festival, a lot of people will be like, we'll either do it like TIFF in Toronto or we'll do it like Cannes. Either or. As opposed to, what do I like the best about TIFF? And what do I like the best about Cannes? And how do I marry them and create multiple solutions, multiple creative solutions? This is the kind of mindset we need to think about. This is what we need when it comes to healthcare. A lot of people are like, it cannot. Privatization, absolutely not. Well, maybe there's an element to privatization that can be digestible, depending on the sector, depending on maybe it's a public-private partnership where it's publicly funded money that's used in the private sector. Like, think outside the box and don't judge. Like, don't be so judgy out there. Like, it's insane right now that people will throw out these ideas and without reading or looking into it or just based on the person that's saying it, it's cancel culture. Like, there's no way we should not listen to them. That time is done. At least for me, it's done. Be open, be kind, and be willing to hear people that are not in your camp, because this is how we get out of this. This is how we get out of these issues. Because right now, I'm telling you, Canadians are suffering, and the time is now for us to act. And I want to be part of the solution. We're doing our best, starting these conversations, going on now, leaning on innovation to try and come up with creative solutions, leaning on AI, having conversations with important people that are willing to listen. We want to be the change, but let's have some urgency. Do you know what I'm saying? Let's act like this is going to be life-saving, because I'll tell you, I've seen people, unfortunately, pass as a result of the lack of primary care, the long wait times in the emerge. Like, this is not some like hypothetical scenario. And if you hear some frustration in my voice, it's because I've been talking about this for too long. Let's do something. Let's get that urgency. Let's create that energy. Like, you know how in COVID, we were willing to think outside the box and pivot when things weren't working? Let's have that same level of energy, approach. I'm sick of seeing people suffer. And last thing I'll say, in all of this, let's invest in prevention. Like, a career is seeing the sickest of the sick in the ICU, addressing their needs, and I can't tell you how hard it is to see patients go through an ICU admission where they're away from their loved ones, they're sick, they might not survive, they become significantly deconditioned. Their road to recovery, if possible, is not always there, and you suffer. And from my perspective, why not do all we can to prevent people from landing in ICU? And that's why you're seeing the passion with all the content, how we eat, how we move, how we reduce our stress, and the importance of connection and connecting with others, how we foster that. And my call to action for folks is, one, really acknowledge how important it is to do all this and to that it matters. And I've seen the results when people take care of themselves. You really do have better outcomes, or you do avoid seeing someone like myself in the ICU. So believe that. And second, our decision makers, let's be passionate and invest in this. Let's encourage people, whether it's tax rebates, discounted insurance, whether it's creating that environment within your healthcare team or your business where you are promoting healthy living. Like, let's get behind this. Let's create that movement. Let's make getting healthy sexy again, folks. That's what we're all about. All right, let me know what your thoughts are on some of these ideas. As I said, this is the stuff that I get most passionate about talking to organizations about. And after that last talk I gave, once again, to some big wigs in the Canadian government, it felt like these conversations make a difference. I truly believe that. So let me know what your thoughts are. You can always reach out to me on any of the social media platforms at Kwadcast, and let's make that change together.